Welcome to 26 Minutes with Dr. Warren Seigel here on the Zurmed Show. I am Dr. Warren Seigel, your guide to the world of health and medicine. Today we're honored to have Dr. Ken Hupart from South Brooklyn Health with us. Together we'll explore the complexities of diabetes. Dr. Hupart, it's a pleasure to have you on the show today.
And it's a pleasure to be here, Dr. Seigel.
Thanks so much for coming. So tell us a little bit about yourself.
I'm a native Brooklyn guy. Born in Brooklyn, raised in Brooklyn. I lived in Canarsie for most of my years, and it was really great when I came back here to Brooklyn to practice about 9 years ago. I went to school in New York City at Columbia. I then went to medical school in New York at Stony Brook, and then I did all of my training. For a Brooklyn guy, I trained in the Bronx, so that was a little getting used to. But now I'm back in Brooklyn, and I'm helping take care of patients with diabetes right here at South Brooklyn Health.
Well, we're happy that you decided to come back to Brooklyn. So tell us a little bit about your specialty.
So I trained in endocrinology, diabetes, and metabolism. It's a subspecialty of internal medicine. I think most people know internal medicine's taking care of the illnesses of adults. Endocrinology is looking at diseases of hormones and glands. And the one that more people have in the United States than any other is diabetes. And a lot of my practice is focused on caring for patients who have diabetes.
It seems like you can't watch a TV show without seeing a commercial about diabetes lately. How common is diabetes?
I thought it was just because of the shows that I watched. Do you see it also?
I see it on everything. It's all the commercials. Is this really that common?
There are about 330 million people living in the United States. 38 million of them have diabetes. And it's kind of scary because about 1 out of 5 of them don't even know that they have diabetes. So we have a lot of people living here in the United States with diabetes, and a lot of them don't know about it. In addition, there's this condition, prediabetes, who are people who are at risk and have a much higher likelihood of developing diabetes. There are almost 100 million such people in the United States. So that's why we're seeing and hearing so much about it.
Well, that's incredible. So people could, you say, could be pre-diabetes, meaning that they're going to develop diabetes. There are people who have diabetes, some of whom don't even know that they have diabetes, so they're obviously not being treated. Are there signs or symptoms that people should be thinking about and worried that maybe they are pre-diabetic?
So prediabetes is something that we see much more in adults than we do in children. There are 2 kinds of diabetes. Type 1 used to be called juvenile diabetes, but now we know adults can get it also. If they are coming down, if children are coming down or other people with type 1 diabetes are coming down with it, we're going to know about it pretty quickly. They get ill, and they get ill very fast, and we have to recognize it, or there are terrible, terrible consequences. But the more common type of diabetes, much more than 90% of everybody with diabetes, are the type 2, which used to be called the adult onset, but children and adolescents can get that also. Those are people who, for the first few years, their blood sugar gets higher, but not high enough to give them symptoms. So they may feel just as normal as everybody else, everybody else who's healthy. And only after a number of years will their blood sugar get so high that they will get the typical symptoms that people associate with diabetes. A lot of times it first comes when people are finding themselves thirsty all the time. They're finding themselves urinating more frequently and waking up in the middle of the night just to go to the bathroom. And then they start losing more and more sugar in their urine. They go to the bathroom more frequently, but they lose calories. So they start eating more, but they don't gain weight. In fact, some people eat much more than they used to, and they start losing weight. So those are now people who have symptoms of diabetes, but if they've never really seen a family member, they don't know people with diabetes, and everybody's busy these days, and people have problems making it to that medical appointment, they may go for many years without diabetes. And in fact, they may have it so long that when they do get diagnosed, they already have some of the terrible complications that people with diabetes are heir to.
So let's talk about complications a little bit later, but I'm stuck on this pre-diabetes. When I think of somebody who has diabetes, I always think of somebody who's overweight, who is sedentary. Are those the kinds of people that we should worry about might be developing diabetes? What puts you at risk?
So diabetes is so common in the United States. Everybody's at risk, even those who don't have some of those risk factors that we're going to talk about. But being sedentary absolutely is a risk factor, and that's become more and more common among the population as we not only have the big television set in the living room, but in every room in the house and in every pocket of somebody with a smartphone. They're looking at screens all the time rather than becoming more active. In addition, people who are overweight or obese are also at higher risk. People who have a first-degree relative, so a mother or father, brother, sister, child with diabetes, they are also at higher risk, especially the type 2. But it's something that's very, very prevalent in our society and in fact worldwide. And we wonder now, are there things that have changed in our environment that are making diabetes so much more common? And there's a lot of research going on about that, but I'd say the story's not yet unfolded.
Interesting. So when we talk about our environment, I think of the smartphones. I think of my TV. I think of lack of exercise because I'm working more, not eating right, not sleeping right. Are there things that people should do to decrease their likelihood of developing diabetes?
Absolutely. First, it's physical activity. Highly important. And if people can do something to keep track and make sure that even though we're a more sedentary society, they're not going to let that affect them. One of the things that we've noted is that people who will do some degree of aerobic activity for about 150 minutes a week, so 30 minutes 5 times a week. They go for a walk, not fast, and especially if you're older and you may have heart disease, take it slowly, but going for a walk is important. And building that up under a doctor's care to the amount of exercise that's right for you. That dramatically decreases the risk of diabetes. In addition, maintaining body weight, which we know is easier said than done. But there are now so many more tools that we have. First is clearly eating correctly. And so we want people to basically balance off their calories, not put themselves on a diet that's so hard to follow that they'll do great for the first week and then go off of it, but on a food plan that they will be able to eat healthily, balanced meal, fruits and vegetables, and be able to continue that for a lifetime of eating. In addition, there are now many things that doctors can help patients with in terms of losing weight also. And that is just changing dramatically in the last 10 or 15 years. And I think that healthy living style is really what we need to talk about.
So it sounds like we really need to take this seriously early on. Eating right, exercising. This is a show about being healthy, staying healthy, and becoming healthier. Besides eating right and exercising, anything else that we should be doing?
What I would say is that if there's diabetes in your family, if you're part of an ethnic group that has a higher risk of diabetes, so if you are of Hispanic heritage, and especially people in New York here who are from Puerto Rico, they're at very high risk. African Americans are at higher risk. East Asians and South Asians are at high risk. And they may, people of those ethnic groups may have diabetes in their family. People who find themselves at risk should try and define whether they really are at risk. The American Diabetes Association has a website you can get from your phone if you have a smartphone. It's at diabetes.org. And you can take a little quiz which Yeah. Last time I went and checked it out, took almost 45 seconds. And by asking 5 or 6 questions about does diabetes run in your family, what your height is, what your weight is, how active you are, it will tell you if you're at higher risk than average for diabetes. In that case, you should get yourself checked out regularly by your physician. There are blood tests that can be done because people, won't have symptoms if they have prediabetes, but a hemoglobin A1C, which is 1 tube of blood any time of day, would be able to define if that person is at risk for diabetes or actually has diabetes. So I think knowing about diabetes, knowing that if it's found early, treatments can be initiated, and the treatments don't have to be shots and they don't have to be medications. It may just be lifestyle changes, but those treatments may have tremendous dividends 10 years, 20 years, 30 years later.
So if I'm worried about diabetes, I've gone onto this website, I've spent my 45 seconds filling out whatever I fill out. I know my family history, I'm concerned. Do I have to see an endocrinologist or can a general internist do these kinds of blood tests?
A general internist, a primary care physician, a primary care nurse practitioner, somebody who knows how to take general care. If we just take a look at the numbers of patients with diabetes, they are in everybody's practices, and primary care doctors and other primary care practitioners know all about diabetes.
So, all right, so I go to my doctor, I go to my nurse practitioner, I go to a PA, I have this blood test, now I come back and I find out I now have diabetes. What's the treatment? You said lifestyle changes. I assume that means I've got to stick to a diet. Not happy about that, nobody is. I've got to start exercising more. Nobody's happy about that. You mentioned treatment. Let's talk a little bit about treatment. What do we do?
And it's not only staying on the right diet, but it's getting to a more optimal weight. Okay? And I think that that's a long-term goal. So the treatment could be the exercise and the diet with nothing else. But there are many, many medications. Some older, there's a common oral medication, a pill called metformin. It's older than I am, so that's pretty old. There are many newer medications that come in pill form, and they actually are very helpful and they're very easy to take. There are also injections, insulin, which is sometimes taken multiple times a day, and I know people like to avoid it. But for the patients who have the type 2 diabetes, more than 90%, if they need to get an injection, there are other newer medications that can be given 1 injection a week, and you don't have to go to an office. Patients can give that to themselves. And these newer medications are helpful in terms of they can provide assistance in losing weight. People's appetite tends to go down. They can also be very, very beneficial for people who may have some of those complications that we alluded to earlier, and may help prevent cardiovascular disease. There are oral medications that have been shown to help in patients who might be at risk for developing kidney disease. It may prevent that or delay it rapidly. And we have these beneficial medications that are changing everything. And some of these medications were first used for diabetes, but then people are now using them just for their weight loss benefit, just for their benefit for heart failure, or preventing other cardiovascular disease, or preventing the kidney disease that we spoke about.
So this is really interesting. So what I'm hearing is I can prevent, or at least decrease, the likelihood that I'm going to develop diabetes by losing weight, or at least getting to a normal weight, watching my diet, but that's also part of the treatment if I have diabetes. Did I get that right?
You got it right, absolutely.
So just because somebody has diabetes doesn't mean they have to be on insulin, doesn't mean they have to be on oral medications. They can work with their primary care doctor, their endocrinologist, their nurse practitioner to figure out lifestyle changes as part of treatment. And then how do you decide when somebody needs medication, whether it's oral medication, pills, or insulin?
So that's a little bit difficult, and it's part of the art that we always talk about with medicine. Some people who will have symptoms and their blood sugar is so high, we might start them on insulin when we first see them because they will have a blood sugar that's more than double or triple what it's supposed to be. And we have to really initiate some therapy really, really quickly. But in other people, if it's just lifestyle changes, it's oral medication, there may come a time when it just doesn't work. And we have these goals that we set. We now really want to get people's glucoses just a little bit above what somebody who doesn't have diabetes is. It's been shown time and time again to help prevent some of those bad occurrences that can happen to somebody's body that can threaten their health for the long term if we get their blood sugar down closer towards normal. If we can't achieve that with all of those other medications we're talking about, we may want to intensify the therapy, including looking at some of these injectable medications. But it's not only the diabetes medications. 2 out of 3 people with diabetes are going to die of cardiovascular disease. So if we find somebody early, like we've been talking about, before they have symptoms and are able to start them on treatment for diabetes, they suddenly become a candidate for much more prevention than does somebody who doesn't have diabetes. So if somebody comes in and they just get diagnosed with diabetes and they're feeling great, we're going to give them cholesterol-lowering treatments and approaches as if they already had heart disease. That's been shown to prolong their lives. We've been taking different approaches to taking care of people's blood pressure if they have diabetes. And something that a pediatrician is very well aware of, we change the way that we approach infection prevention. So we immunize people differently because if somebody with diabetes gets certain infectious diseases, it may cause a much more difficult course, better to prevent it. So we have all of these preventions that we can initiate at the same time.
So we've talked about prevention. We've talked about changing our lifestyle. We've talked about watching what we eat, keeping our weight at a normal level. We've talked about increasing exercise. We've talked about going to a primary care doctor or nurse practitioner, getting a blood test, and if you have diabetes, figuring out with your healthcare provider what's the best course of treatment for you. You've mentioned complications a couple of times. I hate to talk about complications, but we've got to. What are the complications? Not to scare people, but what are the complications if we just say, I'm not going to bother? What are the things to worry about?
So they are worrisome, they are scary. But we now have so many tools that help us help patients who were destined perhaps to get some of those complications, not get them, have them more mildly, or just delay them so that they get to be 80 years old and it didn't cause them to miss a step in terms of going forward. I have to tell you, some of the things I remember about my patients most are the effects of these complications, and I have to tell you, we see them so much less right now. When I was a postdoctoral fellow in endocrinology and was seeing my clinic patients, you would go out into the waiting room and there were invariably people with seeing eye dogs. There were people who had their pant leg folded up because they needed to undergo an amputation. There were people who had their blood vessels altered so they could actually undergo dialysis. There were people who were terribly affected by diabetes. If you came down to my clinic today and you took a look in the waiting room, you couldn't tell that I was seeing patients with diabetes because all those things occur so much less than they used to occur. But diabetes does cause an increased risk of heart disease, causes an increased risk of heart failure, an increased risk of strokes, an increased risk of kidney failure and blindness, nerve disease so you don't feel things so well or worse, poor healing wounds so that your skin may no longer be the barrier to bacteria that everybody's skin should be, And bacteria can get into the inside of our body, under our skin, and those infections can do terrible, terrible harm to people. But now that we are finding people with diabetes earlier in their course, starting treatment, prevention, teaching people about their own condition, okay, we're seeing that less. We're focused on the preventive strategies. So I talked about immunization, lowering cholesterol, different ways of taking care of blood pressure, looking for some of those complications much earlier on when they still may be reversible. They've all contributed with getting the glucose under better control to preventing these complications and delaying them and giving people healthier, happier lives. There are also things that people don't speak about too often, but diabetes can also cause problems in men and women with sexual function. And there are approaches towards lessening that or preventing some of those complications also.
So it sounds like diabetes is a pretty serious disease. It's clearly a chronic disease for so many people, but it doesn't sound like it's a life-threatening disease anymore. Is it why I'm seeing all those commercials?
They seem to be a little too joyous, don't they?
Yeah, they really are. I don't think anybody is happy to have diabetes, but it sounds like this is a treatable disease if you get to a primary care doctor early, get the blood tests necessary, and get into a treatment regimen.
If you want to ask me, how do I gauge success?
Yes, exactly.
So I gauge success when I know that somebody is able to live the life that they were destined to live, that the diabetes that they had was something that caused them to take some medication, monitor themselves, do other things, maybe exercise more, but they got to reach a very nice age. They got to see their child graduate from high school and go beyond, and they got to see their child give them grandchildren and beyond, and they really got to live life to their fullest. And we can now say that with all of the tools that we have, we can really give that outcome to more and more people with diabetes. So it becomes something that needs to be attended to, but doesn't take away from their longevity or their quality of life.
What a wonderful way to think about what used to be a life-threatening and life-altering disease. It sounds like endocrinologists really have done a wonderful job. And I really want to thank you for being on the show today.
Well, I appreciate that you're giving diabetes its due moment and that you invited me. Thank you very much.
A pleasure. And that brings us to the end of our program today. We sincerely thank you for tuning in and learning alongside all of us. For more information about our show, please don't hesitate to call us at 718-510-2103 or visit us online at www.zurmed.com. Stay updated, stay engaged with South Brooklyn Health by visiting our website at www.nychealthandhospitals.org, South Brooklyn Health. This broadcast was proudly brought to you by Brick Media in partnership with South Brooklyn Health. Until we meet again, stay informed, stay well. Thank you so much.